We're bringing in Dr. Juan Carlos Abanses. He is an emergency room doctor at St. Joseph's Children's Hospital Emergency Department and Trauma Center to learn a little bit more about the steps they are taking to protect you. So let's get right to it. Dr. Abanses, can you talk to us a little bit more about what St. Joseph's Children's Hospital is doing to protect patients and families in our area?
I think one of the big things for them to understand is that we have taken lots of precautions from the very beginning of COVID to try to keep patients separated who may have COVID symptoms from other patients. And we've done lots of stuff to kind of clean the emergency department. We have special machines that clean, use UV light to clean after everything. We wear special gowns and masks and procedures for any patient that might have COVID-like symptoms. So we have lots of different precautions that we're using that go along to CDC criteria, and we've started initiating those from the very beginning of COVID. So one of the big fears is that, will my child be exposed? And the reality is probably not. I mean, we actually are very safe. It's probably much safer than going to the supermarket.
Have you had any COVID cases diagnosed just among staff?
We have not had any nurses or doctors who have tested positive because we're taking such stringent requirements as far as when we go in and take care of those patients, and then the cleaning and then our operations, that none of the nurses or physicians have gotten it either.
And as far as the experience, what is it like now when we do have to bring our children into the ER?
So what we created a triage tent, so that as soon as you get into the parking lot, that they start to separate from the parking lot immediately, whether or not patients have COVID symptoms or not. And then anybody with COVID symptoms, we try to keep them out of even going into the lobby area, and try to get them directly back to rooms. So we did have a lot of that initially, and we're still doing that, but that's the initial point of contact right there. And then so that they're triaged differently and brought into the hospital sometimes in a different way also. So if we know that they're COVID positive, we sometimes try to walk them around a different way, even where they're not going through the lobby.
All right, so you're saying that in some cases that parents are waiting way too long to bring their kids into the emergency room with certain injuries. Can you talk about what you're seeing?
I think especially like appendicitis is one of the big ones, for example. So a child will have appendicitis, they have a little bit of abdominal pain, the parents are a little bit scared about kind of coming in. And then by the time they come in, the appendix is ruptured and they're sicker and they have to be on antibiotics for a longer period of time. But we're seeing a lot of other ones. We're seeing a lot of patients kids have broken their arm or their leg, who have fractures and don't come in a timely manner as well. We're also seeing more kids are coming in late with lacerations. And then because parents will kind of wait to see, do I really need to get it sutured or not? Does it really need to be stitched up? And what we find is that they're waiting a little too long. And we normally like to stitch kids up if they need stitches within that first 8 to 12 hours, because after that, if it's been there too long, there's an increased risk for infection, which can cause more scarring. So we really prefer to kind of, if we need to stitch someone up, to go ahead and stitch them up early. Other things have been seizures, because seizures can be caused by a bunch of different things. Many of them that are very emergent. So in kids who don't have a seizure disorder, who have new onset seizures, we want to see them early so that we can try to figure out, hey, why are they having the seizures? Is there something that we can treat or prevent or do something with to make sure that child doesn't continue to have seizures throughout the night. Head injuries also. Head injuries, if children fall and hit their head, not all head injuries need to come to the emergency department, but any kid who was knocked unconscious or has vomiting or the headaches getting persistently worse instead of better, we worry about those. And so we worry about the potential chances of having a bleed, which if the child has a bleed, we don't want them waiting too long at home. We want to be able to get them in to look to make sure it's not, and to make sure that they have treatment.
And just out of curiosity, what are the injuries that you are seeing now? Obviously, our lifestyles are very different.
We are seeing a little bit more of ingestions because the kids are running around the house and don't get noticed. So they accidentally pick up a pill that dropped on the floor because they're inside the house for a longer period of time. So one of the big things that we have seen is we've seen an increased number of drownings and near drownings. And one of the reasons is that I think kids are home a lot more. They're not in the school. And then parents are also having to work from home or being on more Zoom calls or heard different things. And so sometimes they just kind of, attention may lapse for a moment and the child can get out within a minute or two. And if they can get out quickly through a door that's just not realized, they can get into the pool, and that's where we're seeing some of these drownings. So that's why it's really important to have a fence that goes completely around it, that even if they get out through the slider or out through a door in the house, they still can't get into the pool. Or having a pool alarm so that if the child goes in, there are pool alarms, and then you know that they're in there. It's also important that if we start having summertime and kids are having more parties or kind of hanging out in the pools a little bit more, is always to have one adult who's really watching the kids in the water and not just text messaging or playing on their phone, but somebody really to watch, especially younger kids.